I am Community Chloe of Urban One, and welcome to Her Story RVA. It's a virtual women's empowerment series curated with Black women in mind. Now, this episode is presented by Urban Baby Beginnings. Urban Baby Beginnings has been recognized as an innovative and supportive maternal health model throughout the state of Virginia, and we're going to find out why. Joining us is our very special guest, Stephanie Spencer. Come on over, Stephanie.
Good,
How you
good
doing?
afternoon. I'm just fine. Thank you so much for the wonderful introduction.
Absolutely. Now, Stephanie is founder and executive director of UBB and holds several roles in promoting safer motherhood and newborn health. And I can't wait for this conversation. She received her bachelor's in nursing at Regent University and her bachelor's in leadership studies with a concentration in economics and finance from Virginia State University. She's the mother of 3 children and 1 grandchild. Now, throughout her work over the past 27 years, Stephanie has been a vocal and consistent advocate for improving maternal health, equality, and reproductive justice. And that's important to me. So, Stephanie, I got lots of questions for you, right? I see you here, there, and all over the place. Now, for our listeners who are just joining us and our viewers, can you share with us exactly what UBB is striving for and how did it come about?
Absolutely. As you mentioned earlier, we've been around for 27, now 28 years, and we've just been a staple in the community to provide support for pregnant and postpartum people and their children up to the age of 3. We've done a little bit of everything. We came about as a early childhood center for families, and really found that when you work with people directly, they really have a lot more needs than just the initial primary thing that they may be presenting for. And so what we found in talking with our moms, and me being a mom myself, that there was a lack of support and resources for people that were in a concentrated space and that was accessible. And so the model that we created with Urban Baby Beginnings was using the voice of the moms who asked us to build this. And so what you see today is a maternal health hub that transforms communities and provides a safe space for pregnant and postpartum people to reside. And they're able to connect with community health workers and doulas who are from the communities in which they serve. And really, our whole goal is just to improve outcomes and improve access and create a village mentality for people, because we cannot parent and birth alone.
I love the 2 words that you're using, village and a hub. And you touched on it a little bit, but I want you to break it down. What services does Urban Baby Beginnings provide?
So our community health workers and community doulas provide pregnancy, birth, and postpartum support. So we provide advocacy. We can provide navigation. So when people need to get connected with things like Medicaid or housing resources, food resources, we have people who specialize in being able to do that. But one of the big things that's a commonality about Urban Baby Beginnings, because we use this village approach to care, is the advocacy tool that's using someone who's familiar in your space to help to share information and connect the dots so that you can ensure that you feel very well supported. And so our model of using community doulas who are trained in lactation support, birth and postpartum support, and our community health workers who are trained on health promotion and navigation, bring the 2 together underneath this hub, which allow people to have the support that they need.
Now, again, back to the village. And for folks who are just watching us, what is a doula?
A doula is a professional who has education in pregnancy, birth, and the postpartum period. Her true role is to be a listening ear for the person who has hired her to be able to provide this support, to provide knowledge, and then advocacy in all spaces. And so what we really want to do is to empower birthing people and women to have information so that they can make the best choices for themselves and their children. And we're really a bridge between the clinical system and the community-based system.
Wow, this is good stuff. One of UBB, the main goal is to decrease the rate of preterm birth, maternal morbidity, and infant maternal mortality while ensuring that our children are school ready through your early childhood development program. How do you accomplish this? Because that's a lot.
It is a lot. It is a lot. And I can think of myself many, years ago when I had my first baby. I felt like there was so much information I needed to know. It was the first time really people were talking to me about what this need was, right? So
Right.
it's going to the doctor and, people were checking to make sure that the baby was growing well. But I knew that there was this whole pathway that I needed to get to, and it really just didn't exist. And so, what we know is that when people have solid support systems that are positive, that are accessible, and when they have the tools that are necessary to make the choices that they need in their care, along with connections to just basic needs, things that are important for our health and well being, nutrition being one of those things, that all those things combined lead to better outcomes. And so, how we achieve that is really using a collaborative approach. It's not just about the doula or the community health worker. The mom and their family is at the center of all that. You've got providers who are working with families. You've got all of these social structures that all kind of come together. And we really pride ourselves in coming together with everyone, community-based and clinical systems, along with the parent, to make that journey together. And yeah, it is lasting. You're right. Like it seems like a lot when I say make a child, help a child become school ready. And,
Right.
it means that we have to get to the age of 5. And, how we're really doing that is providing the same things, connecting moms to child cares that, are affordable and accessible, providing home visiting support where we're going over, educational sessions and really just talking about reading to our babies, all the things that parents have to do to help their children thrive. So those are some of the things that we do.
And I think it also helps with the disparities when it comes to healthcare, when it comes to learning ability, and regardless of your zip code, we want to get our kids prepared at the age of 5 for life. And how do we get there? And I'm so honored that Urban Baby Beginnings, you're doing just that when you're talking about the doulas and support. And I know it's a lot of folks who could be watching who have, they're pros in having babies and they didn't have their support. And some women didn't, but they have successful babies. But for our viewers who are feeling alone, we really want you to connect to Urban Baby Beginnings to become a part of the village, to get your doula support and all services that are available in this village and this hub. And I thank you so much, Stephanie, for all you're doing. UBB and its partners work to reduce disparities for childbearing women of color by providing access to your doula network through Project ReByrth. What is Project ReByrth?
Yeah, yeah, that was one of my special things that I felt like we really needed to do for our moms. And over the years, I mentioned before, being a mom myself, I have 3 children. So, each one of the pregnancies was very different. And, being a woman of color, I know that there are many things that we need to talk to each other about that we don't often get an opportunity to do in safe spaces. And so Project ReByrth was born not only by the voices of our moms, but how, I knew care needed to be delivered. We were holding systems accountable for saying that Black and Brown people were deserving of high levels of care. And Project ReByrth was born. And it really is a space that allows for women of color to come and reside and commune with other women of color who are in the birthing space. And so what that means is you have access to my team virtually. And they're all individuals of color. You have access to tools for people in spaces such as clinical systems and hospital systems. We actually are ingrained in many of the spaces that our moms are engaging in. And we really, I guess if I were to say anything, I just feel that being a woman of color just adds an extra layer onto the complexities of all the things I'm dealing with. And it does. And all the other part is what it does is that what we hear in the media, about the disparities and infant mortality and all of these things takes away just the vitality that really exists in our communities already, and that we are thriving. And we want to bring joy into birth for our moms of color. And so Project ReByrth does just that in that virtual and ground forces space. And we have doulas who are trained and who are birth workers who provide that birth support to the young ladies that come through our hubs as well.
What impact has Project Rebirth had on women of color or people of color, if you
Mhm.
will?
So before, there really was not a safe space for women of color to reside. You couldn't come to me, and you'd have to find me, and it's really difficult when you're in spaces where you feel like there's a lack of trust. And you know, we know that care traditionally was not provided in hospital
Mhm.
systems. It was provided in the community by Black midwives and individuals of color. We didn't have access. And so, it has made a huge difference because there's a familiarity, there's a safe space where you can come. I have babies that have been with me for years. They see me on the street and they're like, Miss Stephanie, what are you doing? And to see that grow and continue on is in itself a legacy that we want to continue to build. So when we talk about Project Rebirth, we're really talking about transforming communities and ensuring that we maintain what we've done in our communities and transforming them into these positive systems for our moms and babies to thrive. And so Project Rebirth represents that voice.
I just love it. And I think it's so important and to talk about this when it comes to women or people of color in the birthing space, in the birthing community, because when we have aches and pains, it's not considered a real issue. And so simply having the support of the doula network and all of the works that you're doing with Project Rebirth, I think it's going to help and it's going to move the people of color from the disparities when it comes to our children.
For sure.
That's
Because
what
we
it sounds
can,
like.
yeah, and we empower each other, right? You don't have to
Yeah.
know everything. You don't have to know everything. You need to have the support system that is going
Hmm.
to carry you through. I mean, and just in my own personal life, had a hospitalization recently, and I used what I knew in the space of being a doula to be able to help me to navigate in a very tough system. And we just have to remember that each person has a piece of that pie, but at the
Yeah.
end of the day, most of what's going to happen is going to be at the community level. And why wouldn't you want to have some high level of support that's accessible to you, that's beautiful, that makes you feel special and valued and helps you to attain the things that you want, which is you want a healthy baby. You want to be healthy. You
Yes.
want your family and your community to be healthy. And that's all we want too. And we just want to be a part of that. And we're honored to be a part of that because the community has helped us to continue to transform what they wish to see for their mothers and their babies. So we're going to be here every step of the way. If you all reach out or just in general, here we are here.
And it is so important to alleviate the stress during the pregnancy and after the pregnancy by having this support. How can pregnant women of color access your maternal hub and your doula network?
So you can go on our website, www.urbanbabybeginnings.org. And when you go on there, you click on Refer Now. And when you do that, that will allow you to put your information in. Also, if you're in the clinical setting, you can let the provider know that you wish to have a doula and you want them to send that information to Urban Baby. We want this to be accessible and easy for you. And if
Mhm.
for some reason accessibility to like website that might be difficult, you pick up that phone, call us, and that's 833-782-2229. So we want you to call, we want you to text, we want you to go on our website and put that referral in so that we can work with you all today.
Well, thank you, Stephanie. And I know you're doing big things in the community. A few weeks back, we were down in Petersburg for back to school, and you had a wealth of information for new mothers and mothers to be and kids under the age of 5. I've been watching you. So, what are some other ways that you impact the community through
Oh, yes.
Baby Beginnings?
We have two special things that are always part of our heart as well. One is our diaper distribution. So you'll see us doing a lot of that. In COVID,
Yeah.
we distributed over 2.8 million diapers to children just in the city of Richmond alone because these babies needed this. So that's one big thing that we do. You'll also see us, we're big promoters of, infant feeding for our babies. So we have access to gift cards for our babies that are under the age of 1 who are City of Richmond residents. And you can go on our website and select that as well. But if anything, and you ever just see us out there, one of the big things we're doing is just making you feel like all of us are a part of community together and sharing information. Because even if you don't join me today, I want you to feel comfortable and my team wants you to feel comfortable in being able to advocate for yourself. So we spend a lot of time doing advocacy efforts, going into governmental systems, clinical systems, trying to change care. You'll see us in all different places. We'll go to the high schools and middle schools, just to share information as well. So we do try to take advantage of and be a part of any event that we can be a part of as well.
Well, I can attest to that. You're out in the community, definitely. How can any of our viewers become a member of UBB? Any specific requirements, and where can they go to get more information about UBB?
Yes. So to become a member of Urban Baby Beginnings, you either need to be uninsured or underinsured or a Medicaid recipient. That's one of our qualifications. If you're a woman of color and you're in the Central Virginia area or Hampton Roads area, you can also become a member as well of our hub. When you go on the website and you click on the Refer Now button, it actually takes you to a website which allows you to put your information in so that you can become a member. And then our phone line, if you recall the phone line that I gave earlier, the 833-782-2229 number, we have a 24/7 that if you do have any questions in English or Spanish, you can reach out and they will instruct you on, one, how to get more information, and two, also how to register. They'll help you through that.
Well, thank you so much. And for folks who are just joining us, I have my very special guest. She's executive director and founder of Urban Baby Beginnings. But before we go, why did you start this? Why start Urban Baby Beginnings and then move over to Project ReByrth? Why?
Ooh, so I think everybody has their short-term story or long-term story. Like mine, I said I always wanted to be in health and wellness, and there was more to community than just going and buying things and just trying to attain financial wealth. That was one big part. Health and wellness determined everything. And in growing up, unfortunately, what we see, especially with Black and brown women, is that regardless of the amount of education you have, you can still have complications, in your pregnancy that are related to other aspects of your care, bias in healthcare and the like. And my family was very much a part of that statistic. And really, to be honest with you, I didn't want any other woman to have to deal with what I had to deal with. I didn't want to see that. And, then I started to talk with other moms and they started to share their stories as well. And we all collectively came together to build what you see today. And so, my heart is in this work because there can be pain when there isn't the supports that's needed. And I don't want anyone, not one family member, to ever have to go through the stories that I can tell you over my lifetime. And as I continue to hear more from other moms who were experiencing similar things, I think what we realized, the biggest part was that many families were very, very isolated. I felt isolated in my pregnancy. I felt rushed during the times that I was going through my visits. I watched family members going through the same, and we knew what was going on, right? And though we weren't perfect in all of the things, we had a plan. We knew what was going on. And for all of us to have these similar stories was just devastating. And so, my heart is in this work because when you have loss, when you've experienced, tragedy because of carelessness or not listening, you don't want other people to experience that. So if anything, regardless if Urban Baby Beginnings was standing or not, you still hear me talking about this and trying to empower people. My first doula client was over 30 years ago. That was my first doula client. And so I've been in this work a very long time, officially and unofficially. And so I will continue to push forward and continue to ensure that moms have the support that they need so our babies can thrive. And that's always propel our efforts. And it's always going to be based on what the community's voice is telling us that's going to inform the work and it's going to help us to build what is needed.
Thank you so much. And for our young women who are pregnant now and they don't know where to go and what to do, and they don't have that family support, please go to the website. Please go to urbanbabybeginnings.org. That's urbanbabybeginnings.org. And you can see it on the crawl right here on your screen. Now, Stephanie, before we go, what advice do you have for young women who are pregnant and need help, but doesn't know really where to go and to take that first step?
Yeah, yeah. The first step is trusting yourself and that know that you need that support. I think that we don't do enough to just honor ourselves and what our needs are and putting
Mm,
ourselves as a priority. Second
yeah.
thing I say to young ladies is don't delay in the care. Just because you don't have access to insurance or everything's not right and great, that doesn't matter. We don't care. You can present whatever kind of way. And those two steps are going to help you to engage very, very quickly in systems. I also want to add that advocacy matters and knowledge is a tool. And
Mm,
having a doula, having these support systems brings all of that together so that you can inform yourself so that when something pops up that isn't right, you know how to go through all of that. And so I always want to challenge my moms at any point in time, aside from just engaging in care early, getting to a trusted system of support, trusting your gut that is telling you, hey, I need somebody, and knowing where that is. And,
mm,
like I said, you don't have to present any kind of way. You just got to come to us, right? So I'm not expecting anything other than
right.
just to see your beautiful smiling faces, and we'll work on the rest together. So I encourage all of our young people to recognize that and to know where to go, and then we'll figure out the rest together.
Thank you, Stephanie. Lots of information shared here today. And for all of us women who have had children, this is a good idea to link to you to support with them. There's no one pregnancy, no one same pregnancy. And for the families who have family support, like I did, I don't think I could make it or could have made it without a strong family unit and also a doctor who was caring. My gynecologist, my doctor, my OBGYN, she was caring. She had questions for me. I had questions for her. But that's not the case with all relationships when it comes to this. And what I like most about my takeaways from this, and I'm pretty sure our viewers have a lot of takeaways, is not only the healthy baby. You mentioned that. Hey, we always talk about I want a healthy baby boy, a healthy baby girl, but you want the health and wellness. See, by the time that baby turns 5 years old, you want that baby to have wellness holistically from the top of that baby's head to the bottom and the soles of their feet, because we want to end the disparities. And we can end those disparities by simply joining your network, your village, your maternal hub. And that is a major takeaway. Those are major takeaways for me. So Stephanie Spencer is founder and executive director of Urban Baby Beginnings. Thank you so much for all you do. And we're going to be back next month
Absolutely.
with episode number 2 coming up on December 8th. And we're going to be talking about the doula support services and how they benefit maternal mothers. This has been Her Story RVA, presented to you by Urban Baby Beginnings. I am Community Cloak. You're always updated.